Hi everyone, welcome back to my channel. My name is CJ and today we will be discussing the true crime case of Kimberly Clark Saenz, who was a dialysis nurse that took the lives of 5 unfortunate victims who were her patients at a dialysis clinic. And today we will be discussing her life, her career as a nurse, how she did what she did, maybe a little bit of why she did what she did, and how she was caught. Kimberly Clark Saenz was born on November 3rd in 1973 at Fall River, Massachusetts. She went by Kim with her friends and family, and she was a pretty happy and social child. As a teenager, her family moved to Lufkin, Texas, where she attended Central High School. She did well in her classes, and she was also a part of the softball team, and she was also reported to be a popular cheerleader. So because Kim was doing so well in her classes, she was on sports teams, she was pretty popular, very social, very easygoing. People thought highly of her and thought that she would graduate and go off and do very well in her life. However, she did fall pregnant during her junior year. Her boyfriend, his name was Kevin, and after she gave birth, she dropped out of school, but Kevin stayed and finished off his senior year and graduated. After her son had enrolled in kindergarten, she decided that she wanted to go back to school and get her high school equivalent, her GED. After she earned her GED, she went to Angelina College in Lufkin, Texas, where she earned her vocational nursing license. Shortly after, she was hired as a nurse at a local hospital. Her patients reported that she was very loving, she was very caring, attentive, she was a great nurse, and there were also patients who said that she was really skilled with a needle. Like if she had to do an IV or give an injection, they would always prefer it to be her because she would always do it in a way where it would be less painful. Soon after she landed this job, her and Kevin fell pregnant with a second child, which was a daughter. So at this point, things are going very well for Kevin, Kim, and the family. Their family is very successful. They've got a double income household. They're high school sweethearts. They are active in the church and in their community. But this is really how it appeared on the outside. But on the inside, there was a lot of tension. There was a lot of issues in their marriage and in their family, and both Kim and Kevin were very unhappy. The tensions were really high in the household, and there were a lot of police calls to the home centering around domestic abuse, with Kim being the perpetrator. And during one of these domestic abuse calls, Kim was being very violent towards Kevin, like physically violent towards Kevin. He ended up leaving the house to get away from the situation, and he took the kids and he went to his mother's home, but Kim ended up following him all the way to his mom's house. She continued with the physical attacks, the verbal attacks. She was causing a really big scene outside, and Kevin had to call the police. And after the police arrived on scene, they noticed that Kim was very obviously drunk. She was slurring her words, she was stumbling. It was just a whole mess. But after further investigation and they were talking to Kim, Kim admitted that she wasn't just under the influence of alcohol. She was under the influence of drugs as well, specifically Cymbalta, which is an antidepressant. Now, Cymbalta on its own is a very effective antidepressant. However, when you mix it with alcohol, it can increase likelihood of dizziness and nausea, so it really shouldn't be mixed. And Kim was mixing it, unfortunately. At this point, Kim got arrested for public intoxication, and she also got a criminal trespass warrant that ordered her to stay away from both Kevin and his mother's house. In 2007, Kevin filed for divorce, with the domestic abuse being the main catalyst for this. Around this time in 2007, Kim was working on the med-surg unit at Woodlands Hospital, and her boss started to notice some discrepancies in the drug counts. And post their investigation, they noticed that the drug Demerol was at a noticeably low count. They could tell that a lot of it was missing. And Demerol is a highly addictive opioid. And after they noticed this, they ordered Kim to take a drug test. Now, I don't know if they knew that it was Kim that was stealing it, like if they had suspicion, or if it was on her shift that things would go missing, or if they ordered everyone to do a drug test. But Kim had to do a drug test. And during the drug test, the administrator who was supervising Kim noticed that she was acting a little bit strange, a little finicky. So she went and peeked around the curtain, and she noticed that Kim was trying to cheat on the drug test. After they noticed this, they immediately went to search Kim's belongings, and they noticed a lot of the missing medication were in her handbag, and they fired her on the spot. At this point, this was her 4th termination from a nursing position, and they were all related to stealing drugs. The unfortunate thing is none of the previous employers filed anything with the nursing board to update them like, hey, this nurse is not only addicted, but she is stealing drugs from the hospital. They never reported it to the nursing board, never reported it to other employers. So Kim would just continue to do the same thing at job after job after job after job without facing any repercussions of this. After being terminated from this position, she went on and applied to DaVita Clinic, which is a dialysis clinic, and she was offered the job despite her employment history. And of course, we know that the employers were not reporting, why she was terminated prior, but her employment history had huge gaps and short employment at different hospitals. And these are things that definitely should be looked at with strict scrutiny, especially when you're hiring a nurse to be in charge of patient care, right? You really should be diving deep into why can't you hold down a job? Why are you only at these jobs for a few months before you move on to the next one, But none of those questions were ever asked. Okay, so at this point, like I said, Kim was hired to work at DaVita, which is a dialysis clinic. And really quickly, I just want to explain the process of dialysis because I think that it will be really important to understand the workings of this case. So dialysis is a treatment for patients with failing kidneys. And the way that the process works is they're hooked up to a machine that filters their blood, and it basically works like how their kidneys would work if they were functioning properly. So it gets rid of all of that waste that is built up in the blood. Common side effects of dialysis includes low blood pressure, maybe a little bit of nausea and dizziness, but it's nothing serious or major. After the treatments, because patients can be so fatigued, it's recommended that they kind of take the rest of the day easy and they don't do much to kind of conserve and build up their energy. So all in all, dialysis is considered a very safe treatment process with very minor side effects. And the chances of there being any type of major side effect is very, very low. So keep this in mind. The process of dialysis takes about 3 to 4 hours, and the nursing staff monitors the patient's vital signs during this to make sure that everything's going well and that the patient's tolerating the treatments well. And many patients come in multiple times a week to the same clinic for this hours-long treatment. In 2008, there was a significant increase to paramedics being called out to DaVita Clinic. In the previous 2 years, the paramedics had only been called twice. However, since Kim has been there, the paramedics were called 16 times in the first 2 weeks of April and 30 times in the entire month of April. So it was a significant increase in the amount of paramedics being called out. The main reason why they were being called were for patients going into cardiac arrest. And cardiac arrest is when the heart stops beating suddenly. Thelma Metcalf was a patient at the DaVita Clinic, and she had been attending this clinic for years and years and years before Kim had started working there, and she had never experienced any issues with any of her treatments. However, like I said, this was before Kim started working there. And ever since Kim started working there, she was transported to the emergency room 5 times under the conditions of cardiac arrest. And each time she was sent to the emergency room, the doctors had discovered that she was given too much blood thinner, which is what had sent her into cardiac arrest. And in April of 2008, where all these calls were going out During that month, there were 2 patients who lost their lives, and Thelma Metcalf was one of them. The very next day after these patients had died, the leading clinical coordinator, Amy, came to the DaVita clinic to kind of supervise and get to the bottom of the issues of why the paramedics were being called so often, why so many patients are going into cardiac arrest, and why 2 patients died during their dialysis treatment, which is a very, very rare occurrence. So while Amy was there, she was monitoring the staff, she was monitoring the patients, trying to figure out exactly what the issues were. She didn't notice any issues, but she did order a couple of new machines just in case something was wrong with them. But even though she didn't notice anything was happening, patients still continued to die while she was there. On April 28th, 2008, Kim was taking off of her usual station during the day, and she was assigned to be a patient care technician, or PCT. Specifically, the PCTs are responsible for monitoring vitals and making sure that patients are comfortable. So it's definitely a step down from her normal role as a nurse. And when Kim was notified that she was going to be working as a PCT for the day, she was not happy. She was very upset. She was crying. She did not like this change at all. During this shift, one of Kim's patients was Linda Hall. Linda was a patient at DaVita Dialysis clinic for about 2 years at this point, and she was coming in 3 times a week. 3 times a week for the past 2 years. So she's been there consistently. She's been there a very long time. She knows the nurses. She knows all the staff. She knows the entire process for the dialysis treatment. And on top of that, she's also a very observant person. Every time she would come in, she would always sit in the same chair, which was kind of in the corner where she had a good view of the entire hospital, and she had a nice view of the TV. So she could observe the people, the patients, the workers, and she could also watch TV as well. So with all of this being said, it's good to reiterate that she is very, very, very familiar about the ins and outs of everything, the treatments, the protocols, almost everything. She's very familiar with it all. So about 30 minutes before the end of Linda's treatment for today, 2 patients, Marva Roan and Carolyn Reisinger, began experiencing adverse effects to their treatment. Carolyn unfortunately went into cardiac arrest, with nurses rushing to her aid. So while the nurses were providing life-saving treatment for Carolyn, another patient, Lurleen Hamilton, was trying to get the attention of the nursing staff because she noticed something suspicious about Kim's behavior. After Linda, the other patient, overheard Lurleen voicing her concerns, she seconded as well, saying, "Yes, I did also notice very suspicious behavior from Kim." At this point, Marva and Carolyn were both transported out to the emergency room so that they could receive additional treatment. After Linda and Lurleen voiced their concern to the nursing staff, Amy went over to talk to the both of them about the situation and get more information on what they observed. So Linda reported that it felt like a very normal, regular treatment session for her. She was chilling, watching TV, and doing her normal observations, and she noticed that Kim was being very fidgety, and in her mind she was thinking, I wonder what's wrong with Kim, because she's usually not this fidgety. So after some time passed, Linda was still observing her, and she noticed that Kim walked down to the end of the nurse's station, was looking around, very suspicious, picked up a syringe from one of the drawers. Same thing, looking around to see if anybody's noticing her. She unwrapped the syringe and put it in her pocket. And at this point, Linda was like, okay, why are we being so secretive about taking out a syringe? And then at this point, it gets even worse because Kim, she walks down to the end of the counter. She stoops down, taking a look around. She removes the syringe from her pocket. She places it in a, it's like a cleaning tub. It had cleaning solution in it. She placed the syringe in the bucket and she drew up some of the cleaning solution into her syringe. She puts it back in her pocket. She takes the container, the little basin, the bucket of cleaning solution, and she puts it back where it was at the end of the nurse's station. She then walked over to where Marva Roans, which is another patient, was seated, and she took the syringe out of her pocket and injected the solution into Marva's IV line. Kim then went back over to her station where she was seated, and she kept observing Marva. And she kept staring at Marva to see if there would be like any changes in her behavior. And at this point, Linda also made note of, and also, by the way, all of this information that I'm giving you was provided by Linda during a police interview. So at this point, Linda said that because she had been going to this clinic 3 times a week for 2 years at this point, she kind of knows the protocols, the processes for how things work throughout the day. And specifically when you administer any drug, whenever you use a needle, a syringe, whatever, there's a sharps container at every patient's station. And so whatever you use for that patient, you put it in the sharps container that is at that patient's station. However, when Kim injected that solution into Marva's IV, she did not put the syringe into Marva's sharps container. She instead went over to a different patient's sharps container where she placed the IV. And Linda thought that this was very, very weird. And not only that, she didn't document anything in the computer, because after you administer any drug or anything, whatever, you're supposed to go and document like you gave the patient this at this time for whatever reason. And she also didn't do that. So Linda, the bells were going off. She was like, something is wrong. What is she doing? But also at this point, Linda was really questioning what she saw. Is this really a big deal? Is this something I need to report? Because she didn't want to cause a scene or bring attention to a situation when there's not a situation going on, you know? So she's questioning, because even though Kim is new there, she knows her somewhat and she trusted her and she liked her. And so it was like, what are we doing? Like, what's going on? Linda really didn't know what to do in that situation. It wasn't until she overheard Lurleen reporting it to someone else, or reporting it to some other nurses, where she was like, okay, so I'm not the only one seeing this. She's being weird, right? Okay. While Lurleen was talking, she recounted the same things that Linda also observed. Kim's strange behavior, the syringe, the cleaning bucket solution, getting the solution into the syringe, injecting it in Marva's IV line, and discarding the syringe at someone else's station, and also not documenting what she had just given the patient. After Amy is updated on all of this, she immediately shut the clinic down. She sent everyone home and she notified her higher ups about the situation. She also went over to Marva's and Carolyn's station. She took the things out of their sharps container as well as their line that was connecting them to the dialysis machine, so that they could test it for the cleaning solution. So now when they tested it for the cleaning solution, they all came back positive for containing bleach, which was further attesting to Lurleen's and Linda's claims. The following day, all of the staff members who worked at the dialysis clinic were called in for a meeting except for Amy. The police had gone to Amy and brought her down to the station for questioning. So while Kim was being questioned by the detectives, they asked her to describe her role at the clinic. But instead of just simply answering the question, Kim started going into detail about how she was so nervous about working there and how there were so many processes that were in place that she wasn't used to, and she had to get used to it. And she was just so nervous about doing something wrong and hurting it or injuring the patients in any way, because that would never be her intent. Baby girl, that's not what they asked you. They asked you to describe your role as a nurse at the clinic. That's it. And you can also see Kim's police interview online. During the entire interview, Kim was stumbling over her words. She was not answering the questions. She was talking about things that had nothing to do on the topic. She was talking in circles. She wasn't making sense, which is like, she looks guilty off the bat. She was just coming off as guilty. the first 6 to 8 months that Kim was working at the clinic, everything was going fine. This is what she reported. Then she said that there were a lot of changes in procedures and processes. For this first 6 to 8 months that Kim had been working at the clinic, everything was going well. But then she reported that she was scared that she would mess things up, even though she always did things very by the book. But she was afraid that she would do something wrong and then lose her license as a result. The detectives, they went along with it and they told her to elaborate specifically, why are you so anxious about working at the clinic? And then at this point, she just started sporadically talking about a lot of different topics. Nothing that she said really made sense, but she was saying things about how they wanted her to put on gowns and masks a very specific way. And she was so anxious about messing that up. And then she started talking about the patient's blood pressures and how there were a lot of patients who would complain about having chest pains and talking about getting fluid off of their chest and how there were a lot of new nurses. And at this point during the interview, this is where I really started to have trouble following along to what Kim was saying, because she genuinely, it was just like word salad that was coming out of her mouth. Nothing made sense. It was just a bunch of mumbo jumbo. She wasn't answering the questions. She was trying to stall and deflect, and it was just a whole mess. And you could also tell during the interview that Kim was trying to act very calm and collected, but it was giving anxious, and the detectives noticed this as well. And she continues to talk about things that makes her nervous in the workplace. But again, it was very sporadic, all over the place. She was using a lot of nursing jargon. And so it was very difficult for the detectives to follow. Eventually, the detectives asked him to elaborate a little bit more on the processes of working at the clinic, like the process of how the dialysis machines work and how dialysis treatments work. During her explanation, Kim mentioned a keyword, a buzzword, bleach. So Kim then said, quote, "The dialyzer has renalin in it and it's got to be circulated, because if they get a renal infusion, then they're off to the hospital, because that's like bleach." Okay. Then she continues to talk about the amount of complaints of chest pains that they have been getting from their patients in the recent months, which was very scary for her. And then she said that because of this, she gets very anxious and she really doesn't want to leave her patient's side. And she's constantly asking them if they're okay, constantly checking on them to make sure that they're tolerating the treatments well. And during the interview, Kim mentioned bleach over 20 times, and she kept trying to downplay its use as like standard procedure for cleaning the machines, trying to reiterate that, if you find bleach anywhere, that's normal because we use it to clean the machines, over 20 times. And then at this point, she directly said that it could be the fact that they're using bleach to clean the machines, that it could be linked to the patients having adverse reactions to their treatments. And she said that because bleach is used to clean the machines, there could be leftover bleach left in the machines. And then when the patients are hooked up to them the following mornings, then this could be causing an issue. And then she explained that every Thursday, all of the dialysis machines are hooked up to a bleach bottle that circulates through the machines for 25 minutes to sanitize them, and how she's so concerned about this process because she thinks that there might be residual bleach left in the machines that enters the patient's bloodstream, and she's so anxious because it could kill them, and she doesn't want to kill them. And then at this point, the detectives asked Kim to describe her last day at work, which was the previous day from the interview, how it went, what was going on, explain your day to me. And Kim was deflecting even worse at this point. She was talking in circles. She wouldn't answer the question. She was all over the place. So then Kim says, after they asked her the question, Kim goes, quote, "Tuesday, or what's today? Monday. All right. Today's Tuesday. Okay." So the detectives asked her again, and it takes her a really long time to answer the question. For Kim is like, "Monday was my last day at work. I remember it on the schedule." Which, it's like, they weren't asking her what day did you last work. They were asking her to just describe the last time she was at work and what was going on. Obviously, because 2 patients were sent out. And then after she finally answered, I guess what was the last day she last worked, the detectives then asked her if she noticed anything strange or out of the ordinary. So then Kim answered that the only thing that she noticed that was a little bit off was Marva's IV line had a huge clot in it, a monstrous clot, she said. And when she noticed it, Kim went over to Marva to ask Marva if she was feeling okay. Marva said she was, but then Kim decided that she needed to get a syringe of saline to flush out the monstrous clot that was in her line. So then the detectives asked her where she was assigned to work that day. And Kim said that she was assigned to work in med-surg, but because Tammy Watts didn't come in, she had to pick up her shift. So then the detectives asked her, like, okay, what were the changes in your responsibility having to cover another person's assignment for the day? And this is when Kim said that she couldn't do meds, but each time she went to check a person's vitals, they would push saline through the lines to help with any clotting that might be developing in there. Which at this point, we know that Kim was pushing bleach into at least 2 patients' IV lines. And then she said that she also became really upset during the day because there were some patients who were accusing her of giving them, I guess, the wrong things, which I don't even know how that would happen if she was assigned the role of PCT, but she was saying that there were 2 patients who accused her of giving them the wrong medications, and she was so afraid and upset to the point of crying because she was so scared that she was going to lose her license. And then the detectives asked her if she had given any medications to any patients, and she said no, she had only given saline because one of the patients said that she was feeling some sort of cramping. And then Kim, at this point, she reiterated, no, I didn't give any medications the whole day because of her role. She was assigned as a PCT, which PCTs are not allowed to give out medications. But still, she was so anxious because her nursing license was still on the line, she said. And then, there's a little bit of a pause. Then the detective moves on to asking Kim if there would be any possible reason for any staff members to be using a syringe to draw bleach up into. Kim, initially she answered no, but then she rambled on with some confusing, incoherent something. I don't know. She was talking nonsense. She said, quote, cc's of bleach to put up in there and washcloths in there, but not specifying where. I mean, it would make more sense if y'all would watch the interview because you would understand how much Kim rambled on nonsense during the interview. It's insane. And at this point, after the detectives asked Kim about the syringe, specifically with the bleach, Kim displayed tons and tons of nervous behavior. She was fidgeting, interlocking her fingers, moving around. She can't sit still. Even more suspicious than she had been the entire interview. And Kim had mentioned something about the only reason that a staff member would need a syringe with bleach is if they were getting 10 cc's of bleach. And Kim said specifically that there's a plastic container that you put rags in, you pour the water in, and then you add the bleach to clean off the machines when the patients are done, like the outside of it, and to clean off any clamps or anything. And you need specifically only 10 cc's of bleach, which she used a syringe to measure. So like I mentioned earlier, Kim was using a lot of nursing jargon, and she continued to do this at this point. And then the detectives were like, okay, we're a little bit confused. Can you explain this in more layman's terms and not use so much jargon? And even though she had mentioned the word bleach so many times during the interview, at this point, she's trying her hardest not to say the word bleach. And so Kim then went on to explain that the reason why she was using a syringe to draw up the bleach is because usually they would use like a little medicine cup to measure the bleach, but they were out that day, so she had to use a syringe. Then the detectives asked her if the previous day when she was at work, if she was using a syringe still to draw up bleach to clean the clamps. And Kim never answered the question. She just started rambling on again about the whole process of using bleach to clean it, but she never answered if she had to use a syringe the day before. Then the detectives asked her again, is this a common thing that you do? Did you do it the day before? And eventually Kim admitted yes, that she said specifically that it is standard protocol to use a syringe to measure up 10 cc's of bleach to clean the clamps. The detectives asked her if there were any patients around the last day she was at work who witnessed her using the syringe to draw up the bleach. Again, confusing roundabout answer. It took them forever to get a straight answer out of Kim, but eventually she admitted that no, the patients were not around, I guess. But regardless of all of this, Kim did say specifically that it is standard protocol to use a syringe to draw up the bleach. However, DaVita would confirm that this is not a part of corporate policy. This is not something that they're supposed to be doing. However, DaVita would confirm that this is not true, that using a syringe to measure out bleach to clean the equipment is not standard procedure at all. So then the detectives asked Kim if she had gone near any patients on her last day of work with this bleach filled syringe. Was she near any patients with it? Again, very confusing answer, rambled on, took forever to get to the point, but ultimately she said no. And then the detectives asked her to give her insight on what she thinks is going on with the patients who have received recent complications during their treatments. So Kim then said that she was really concerned about how high the patients' blood pressures were when they initially came in. And she was very concerned about their blood pressure, and she would be going over things in her head to try and figure out if it's something that she's doing wrong, what can they do to address it, that type of stuff. And then the detectives asked her if she had been working directly with these patients who have had adverse reactions to their treatment and needed to be sent out to the emergency room. And Kim, again, never really gave a straightforward answer. She never really answered the question. If we recount the 5 victims of Kim was always on shift, either when one of these patients had died or when any other patients had suffered any adverse effects and had to be sent out to the emergency room. Now, from what we know, these patients were not always directly assigned to Kim, but she would have some type of interaction with them, whether she was covering for a person that had gone on break or if she was responding to any alarms that were going off on their machines. She always had direct contact with the patients some way or another. And there would only be a situation of a patient either dying or a patient being sent out to the emergency room under cardiac arrest. That would only happen when Kim was on shift. So the day after Kim's interview with the police, she was fired from DaVita Dialysis Clinic and she voluntarily surrendered her nursing license. The police obtained a warrant for Kim's arrest and they went over to Kim's parents' house where Kim was at the time. They confiscated 2 laptops and 2 computers that were believed to be in use at some point or another by Kim. So the state forensic computer analysis revealed that Kim had searched bleach poisoning on the morning of April 2nd. This was one day after Thelma and another patient had suffered cardiac arrest and had to be sent out. And that was the day before Amy, the clinical coordinator, had to come in to supervise the clinic. There were also other searches made on May 3rd, 2008, which was 4 days after the police interview. And Kim searched bleach given during dialysis, can bleach be detected in dialysis lines, and dialysis symptoms bleach infusion. During the trial, Kim's defense argued that Kim was being blamed on faulty procedures that were happening at DaVita, and they were using her as a scapegoat kind of to not have to deal with any of the consequences of their faulty procedures. And they also claim that the dialysis machines had toxic water, which was to blame for the medical events. And they also argue that because, after everything had gone down on the last day before Kim was fired, or I guess the last 2 days before Kim was fired, Amy, the clinical coordinator, called her supervisors about the situation instead of calling the police. And that made it look like they knew that Kim was not guilty, because if they knew that it was Kim, that they would have called the police immediately. They also tried to pin the blame on some recalled blood thinners that they claimed that the clinic had, but the clinic never had any of those in stock. Then their final argument was that Kim was not adequately trained when she accepted the position at DaVita. And during the trial, Kim also admitted that her colleagues knew that there were things wrong at DaVita. The staff members were always complaining about the processes and how something was eventually going to go wrong at the clinic. And Kim continued to profess her innocence and how she was feeling railroaded by this big giant company that was trying to use her as a scapegoat for their own issues. When Kim was asked about the day in question, which was the last day that she was at work, she did admit that she heard one of the patient's machines going off. And so she went over there to check on her. She noticed there was a clot in the line, and so she injected saline into the line, not bleach, with the efforts of removing the clot from the line. However, the prosecution argued that there is absolutely no reason for Kim to use a syringe of saline or anything and inject it into the line during the treatment, because all of the patients are already hooked up to saline specifically for this issue. And so if you go over and you notice that there's some sort of clot or whatever, all you have to do is unclamp that bag of saline and let it flow into the line. You don't need to come and introduce a whole new syringe of saline because they're already hooked up. And during the police interview, Linda also explained the process of all of this, and knowing that there is no reason for her to come with some different syringe. But unfortunately, Kim underestimated the amount of attention and understanding that the patients had during their treatment, because she didn't think that they would notice something like this. I should have mentioned this earlier, but the trial began in 2012, and Kim was being charged for murdering 5 patients with the use of bleach. And other patients and staff members also reported that Kim would complain a lot about some of the patients, and the patients who she complained about were the ones who always ended up being sent out in cardiac arrest or ended up dying. Like I mentioned earlier, especially when she first started working as a nurse, a lot of her patients described her as friendly, chatty, and even at the DaVita clinic, some of the patients described her as friendly, but others described her as very cold and dismissive. After Kevin, her ex-husband, learned about the murders, he ended up getting a restraining order against her. In March of 2012, Kim was found guilty by the Angelina court jury, and the prosecutors really wanted to give her the death penalty. She was charged with 5 counts of aggravated assault from the 5 patients who survived her murder attempt, and these were Marva Roan, Carolyn Reisinger, Deborah Oates, Graciela Castaneda, and Marie Bradley. She was also charged with 1 count of capital murder for Clara Strange, Thelma Metcalf, Garland Kelly, Cora Bryant, and Opal Few. Investigators believe that she was responsible for at least 10 deaths, but because the medical waste was removed from the facility 2 weeks before the last occurrence, they were unable to prove that. She was found guilty on 3 counts of aggravated assault for Marva Roan, Deborah Oates, and Marie Bradley. She was found not guilty on the other 2 charges of aggravated assault for Carolyn Reisinger and Graciela Castanedo. She was found guilty of capital murder for the deaths of Clara Sarah Strange, Thelma Metcalf, Garland Kelly, Cobra Bryant, and Opal Few. And like I mentioned earlier, the prosecution was really seeking the death penalty for Kim. However, she was sentenced to 3 20-year imprisonment for aggravated assault and 5 counts of life in prison, with the possibility of parole for the capital murder charge. Kim never answered on why she did what she did, but there are some theories that Kim was trying to take her anger out on being assigned the role of the tech, but that doesn't really answer for the other patients who were affected by her decisions, because this was the one time she was assigned as a PCT. She was not consistently assigned as a PCT. During the trial, Thelma Metcalf's daughter commented that Kim was a psychotic serial killer and she hopes that she burns in hell. So that is the case of Kimberly Clark Saenz and the unfortunate deaths of 5 patients, as well as numerous cases of patients being sent out into cardiac arrest. And all of this is very, very unfortunate, and it's terrifying because Kim, as a nurse, you would think that being in a hospital or any type of clinic where you're receiving services to help sustain your life, you would not instead shorten your life. Cases like this always makes it very, very nerve-wracking and scary to go into the hospital and really wholeheartedly trust that when these nurses and doctors come in, that they are coming in with good intentions, because they have so much power and control over patients in such a vulnerable state. It's awful. It's awful. Let me know what y'all think about this case, and if there are any other cases that you would like for me to cover on this channel. As always, be kind to yourself and others, and I will see you in the next one. Bye.